Right. And you can close your eyes for
Can we
this
bring her
part.
up a little bit more?
Yeah, yeah,
I
exactly.
feel like she's too low.
Yeah,
There we
thank
go.
you. And so, and you can close your eyes for me. And you see I marked two little spots there. And now take a big deep breath for me. And then blow it away. Just a little pinch. And it may burn a little bit. Just going really slowly. And you can see the anesthetic spreading across there. She's doing great. She's very brave. This does burn a little bit as it goes in there. And you'll see that's just swelling up from the anesthetic going in there. And then we come over and give her a little bit more because this is where the main one's bugging her right there. So just put a little bit more on the other side. And that's the one we'll get rid of first because that's the one that's really bugging her, right? So little needle's gone. She's very brave. She's doing great. That hurts, but she...
Oh no, this doesn't hurt. It hurts when you do it at the bottom.
Oh, the lowers are worse.
Yeah, the upper lip, that doesn't. It didn't feel like anything.
Well, she's very brave because it does hurt. I mean, he says good. She's very. No, you're good. You're great.
For most people,
No, it definitely does. I mean, just a little needle. Now this is weird because I have to flip her eyelid. So look down for me, and I'll put the little clamp in there and. Yep, and like down towards your feet a little bit, and then it's got slides up under. It's normal to feel this a little bit when I flip it, okay? And I'll put some more numbing in there. Just a little clamp. This will be pretty neat. We can see the inside of her eyelid. There. And now you'll see, you can see where the like the pus is coming up right there, but the main bump that's bugging her is right there, but there is like a little secondary one right there. So another little pinch here. And this is more numbing going in. Good job. And we're going to put a little more. Perfect. Turn down. She's doing great. So this is the inside of her eyelid. This is the tarsal plate where they form. But you can see where hers is kind of white right there. So we'll just get that started right there. And you'll see some of the pus starting to come out of there now. And I'm going to make the incision a little bit going this way because I think she has, you can see where the secondary one's kind of coming up right there where the pus is coming up. And then we'll use the little curette. And this thing's like a little spoon-like device there. And we just kind of scoop the pus out of there. She's doing great. You feel a little bit of pressure?
Yeah.
Okay. So this is all that junk coming out. And you can try right there. And we'll show you can show them the blood there, but see that, and you see all the pus right there. Okay. All right, let's get it all out of there because now the key to this is getting that out. But there's like a little sac in there you got to get out too. Hopefully we'll be able to show you that. Show blood right there so you can see. And then there's the sty. And they're all a little bit different. But you kind of got to get up under there. To get up under there, to get all the little sac out of there. That's what I'm getting out now. Another little pair of Westcotts. This is a little bit dull in there, so we'll go get another little pair of them so we get all this stuff out. But you see right here on the border eyelid, that's kind of that little blockage right there. That's where it starts on the little white area. Let's hold those guys up. So that's the whole. I think these are a lot better. So yes, I switched little scissors because those other ones were a little dull there. But you'd see, came out really nicely. That's all the junk that came out of there. Good. I'm just showing that. And you see it went, and then this is the other side of her eyelid right there. So you just don't want to go too deep there because it could leave like a little hole in her eyelid there, which we don't want, right?
No.
Pretty young lady. We don't need any holes in your eyelid. So I'll cauterize it to keep it from bleeding. And there might be a little bit of thickness over right there. So let me see that because I feel like this little area here, maybe another one right there.
You want
The
the
west cuts, yeah, just to remove that little area to make sure. I feel like that's where she had a little secondary one right here. Right there. Okay. And that looks pretty good there. Now what I'm going to do is we're going to take the clamp off, and I'm just going to feel it and make sure. It's kind of the most important part. So you'll see, if you look from the outside, that bump is gone now. It's a little swollen from the outside, but what I do is I run my finger on the inside and across, just to make sure I don't feel anything else. But it looks good there. It's nice and flat where that big bump was.
You didn't see anything over here?
No, I tried to feel it over there. There was like a little scar over there.
Oh, that's the scar. Okay.
Yeah,
Okay.
it looks like, because it looks like you may have had one removed over
Yeah.
there. Okay, yeah, so it was like a little scar over there. Then we'll dry everything off, and then what we do is we put a patch on her eye for about 2 hours, and this puts pressure on it. It didn't bleed too much, but sometimes when patients get up and walk around, it can bleed a little bit. And then where hers is located, in the middle there, we don't put stitches in there, you just let it kind of heal in on its own, but it does feel scratchy for about a week or so until it heals in with it. Get here at Eye Clinic, and she did great there. We treat a lot of people with these size or chalazions, which are blocked glands in the eyelid. We do start treating you first with an antibiotic or some drops before we do what we did on her. But once if they don't go away for your doctor, then we can do this procedure, in the office on those people. If people are really apprehensive about it, we do have our own outpatient surgical center where we can put you to sleep if you need to be. But most of the time, we can do it just here in the office. And she did great. She was very high pain tolerance, and she held still, and so she was a great patient. Thank you.
So I'm gonna give this for you to take home with you, but the patch is coming off in 2 hours, okay? Once the patch comes off, you're just gonna use cold compresses 20 minutes out of every hour that you can until bedtime. And then you can, if it's still swollen tomorrow, you can still continue to do cold compresses. You don't have to put any ointments or drops or anything in now. You're just gonna let everything heal on its own. Tylenol if you're a little uncomfortable, and you can use artificial tears if it's a little scratchy. And like he said, it may feel scratchy to you for about a week just because it was right underneath that top lid.
Okay.
All right, and
All right.
that's it.
Thank you so much.
You're welcome. All right.